Hi, so does estrogen therapy help the symptoms that you can get with the really high and the really low estrogens? You know, that estrogen roller coaster where you feel very teary, you feel up 1 minute and then very low the next, or you have heavy periods, you know, those things that happen at midlife. Yes, I think estrogen therapy can help. I'm Dr. G, specialist medical doctor and PhD in midlife women's hormones. So why is it so common, the highs and lows, and what can we do about it? Well, it's common because as we age, we start to lose the ovarian follicles in our ovaries. This is detected by the brain. So then the brain tells the pituitary to put out more follicle stimulating hormone, FSH. FSH then kicks on what ovarian follicles you have to sort of produce more estrogen. And in between the periods of follicle development, we have lower estrogen than usual because you've got a lower pool remaining in your in your ovaries. So the highs can be very high and the lows pretty low. And I explain the loop cycles particularly, which underlie the really high estrogen levels, sometimes 4, 5, 6 times normal, and why we get such lows. So what estrogen therapy can do in some women, not everyone, they can reduce the symptoms that is associated with these highs and lows. Now, not all one size fits all, so some women will feel a lot worse when you add estrogen. Other women will love it because the low is not as low. So they don't feel the bouncing up and down as much. And remember, some people can't clear estrogen as well, and you know you can do something about that. I talk a lot about estrogen clearing. So estrogen clearing is really important in midlife and perimenopause because of the big highs, but also if you take estrogen therapy. Now, I know not everyone's going to want to take estrogen, but it's worth a try talking to your health practitioner. I certainly don't use it on everyone, but I find it really can help a lot of women. Okay, see you next time.